We are Dr. Waney Squier, Dr. Julie Mack and Dr. Anna Janssen. What our paper in the December 2016 issue of DMCN adds is a demonstration of the extensive overlap in the demographic features between infants with sudden unexpected death and those with non-traumatic subdural hemorrhage. At the outset, we express our concerns over the term shaken baby syndrome, used in our review because it is commonly applied to infants with subdural and retinal hemorrhage who have no external evidence of trauma. Our concerns are supported by a review of the shaken baby syndrome commissioned by the Swedish Board of Health and published since our review was published online. Of 3,700 papers studied, the Commission found only 2 which it considered might offer support for the hypothesis that shaking is the cause of retinodural bleeding. We prefer to use the term retinodural hemorrhage of infancy, relying on the objective findings rather than assumptions of causation or intent. Table 1 demonstrates that many of the demographic features common to the 2 groups, labelled as shaken baby syndrome or retinodural hemorrhage, and SIDS, are related to poverty and deprivation. There are 2 notable intrinsic vulnerabilities: age and gender. In both groups, the peak age is 12 weeks. In both groups, male infants are twice as commonly affected as females. There is no male predominance in babies with evidence of trauma, such as epidural bleeding or fractures. In this slide, we explore possible mechanisms for subdural bleeding in SIDS. Firstly, it may be the consequence of a collapse and long period of hypoxia, followed by CPR and ventilation. Secondly, subdural bleeding may precede collapse and be residual from birth. In this case, it may be coincidental and an innocent bystander. Alternatively, the subdural bleeding may not be an innocent bystander, but, due to its inflammatory effects, may sensitize the dural trigeminal sensory innervation and stimulate exaggerated oxygen-conserving reflexes. Perhaps the most important aspect of our review is to draw attention to the importance of the oxygen-conserving reflexes, which can lead to bradycardia and apnea and have been implicated in SIDS. The oxygen-conserving reflexes are mediated by a polysynaptic pathway via the vagal nuclei and are modulated and facilitated by the brainstem 5-HT network thought to be responsible for SIDS. Trigeminal stimulation is key to these reflexes, and sensitization of the trigeminal system may produce paradoxical and exaggerated responses. We suggest that, in the presence of chronic subdural bleeding, choking and aspiration of milk or stomach contents into the larynx or the nasal passages may have a far greater effect than in the infant without dural inflammation. Similarly, even minor distortion of the dura from trivial impact may stimulate exaggerated reflex responses. Infants dying with retinodural hemorrhage might, we suggest, therefore be considered a subgroup of sudden death in infancy, sharing a common terminal process.